My name is Costanza. I am a renal dietitian working in Hammersmith Hospital. I mainly work with people with chronic kidney disease, both in the early stages, on dialysis or after they've had a transplant, to provide them with specific renal dietary advice. I work both in the acute wards and in the outpatient dialysis unit. So Hammersmith is one of the largest renal and transplant centres in Europe, and we cover all of northwest London in terms of dialysis units. So we've got a very wide variety of patients and a really large population that we look after. Being a renal dietitian is quite a demanding role, and it does really allow you to gain loads of transferable skills and experience. Because of how busy the job actually is, you have to have really good time management skills. So being able to handle, say, a very busy ward and a very busy satellite dialysis unit, and then being able to phone patients and organize your admin time. At the same time, it's really important to prioritize working with a multidisciplinary team. So being very open, building a very good rapport with the team that you're working with. It's a discipline that's very holistic in terms of patient care. So you work very closely with doctors, nurses, counsellors, pharmacists, therapists, and all the like. Another skill that's really important in dietetics and that's really easily transferable is reflective practice. So being able to learn from your mistakes, essentially sitting down after you've seen a patient and thinking, for example, what went wrong? What could I have done better? What will I do differently next time? What could I have done more? And I think being able to just evolve and continue to build on your expertise and your knowledge. Something else that's really important to have as a dietitian is good communication skills. So being really clear with your communication, being able to tailor your communication style to the person that you have in front of you, as well as obviously being able to communicate clearly with the rest of the team and writing good notes, really clear and concise notes. Before I became a renal dietitian, I didn't specifically research the role, but I was lucky enough to end up here at Hammersmith for my combined placement 2 and placement 3. So I had loads of exposure to the field of renal dietetics, and I learned a lot about renal nutrition. I was surrounded by very expert renal dietitians, and that was motivating enough to then push me to pursue renal dietetics as a career. I was in Italy all the way up to high school, and then I did my Bachelor of Science here in England. So I studied Human Sciences at UCL, which is a degree that's quite similar to biology, and then I went on to undertake a Masters of Nutrition at King's College, and then a postgraduate diploma at King's. The NHS job application process is luckily quite straightforward. So all the jobs are advertised in one page, so NHS jobs, and there's very clear person specification and job description provided. So what students are advised to do, or people that are looking for a job are advised to do, is just to write a personal statement based on that person specification. And then the second and final step, if you do get shortlisted, is you get an interview with the team. My main piece of advice for students looking to pursue renal dietetics as a career would be to be very vocal with your learning needs. So go to your lecturers and speak to them, or speak to a renal dietitian or anyone that might know a renal dietitian. Ask them to put you in touch and just ask them questions. Ask them more about what their role entails, ask them to shadow. Something else is definitely go back onto your uni lectures on chronic kidney disease and nutrition, read the references, do the extra reading, read the guidelines. Look up the Kidney Patient Association website, for example, and try to familiarize yourself a little bit more with patients' experience of chronic kidney disease. The advice that we provide to people in, for example, our dialysis unit is very holistic and is very rarely just dietary related, because we're thinking about patients that are very complex and sometimes have very complex and diverse needs. So a lot of our role is about really understanding our patients and understanding their needs so we can provide the best advice that we can.